Hey.
Forgetting is normal. What's tough for you to remember is tough for everyone. But don't worry, we've got this together.
Today, let's take a look at how antiepileptic medications work in the brain. Neurons become excited when they receive signals from other neurons. They then pass that signal to the next cell. But the brain doesn't just spread excitement, it also has systems to slow things down when the activity becomes too strong. In a seizure, that braking system doesn't work well enough, and the excitement spreads out of control. Every antiepileptic drug works in one of two ways, including reducing brain excitement and enhancing GABA's inhibitory effects. Let's look a bit closer. When a neuron gets a signal, sodium channels open and sodium ions flow into the cell. This makes the cell excited and active. Then, calcium channels open, allowing calcium ions to enter. Calcium plays an important role. It helps the cell stay excited. It causes the cell to release neurotransmitters, like glutamate. Glutamate is released into the space between neurons and attaches to receptors on the next neuron. AMPA receptors allow sodium ions to enter the cell. NMDA receptors allow calcium ions to enter. This is how nerve signals spread rapidly. But what if there's too much excitement? To calm things down, neurons release GABA, a calming neurotransmitter. When GABA attaches to GABA-A receptors, chloride ions, which carry a negative charge, flow into the cell. This makes the inside of the neuron more negative, stopping the excitement. GABA that isn't used is taken back up into the cell, where it is either reused or broken down. So, how do antiepileptic medications help? Let's start with Valproate. It blocks the enzyme that normally breaks down GABA. As a result, GABA levels increase, and that helps calm the brain. Just remember, V is for volume down. Valproate blocks the enzyme that breaks down GABA, so GABA levels go up, and your brain chills down. Benzodiazepines, Phenobarbital, Topiramate bind to GABA-A receptors and make GABA work better. Be patient today. These guys help GABA work better by boosting its calming effects. Phenytoin, Carbamazepine, Valproate, Lamotrigine, Topiramate block sodium channels so the neuron doesn't get too excited. Please calm very loud thoughts. They block sodium channels. That means fewer action potentials, less excitement, and fewer fireworks in your brain. Gabapentinoids, Ethosuximide, Valproate block calcium channels, helping reduce both excitation and glutamate release. Gently ease voltage. These drugs stop calcium from rushing in, which means less neurotransmitter release and more peace. Levetiracetam binds to a protein called SV2A on the surface of synaptic vesicles. This reduces the release of glutamate, changing synaptic vesicle protein 2A to something like less excitation vesicles. Levetiracetam. Today, we reviewed antiepileptic medications. I'm cheering you on for your exam. For quick, powerful reviews, this is the only channel. Don't forget to subscribe.